Alright guys, let's talk about hygiene and jiu-jitsu. We're going to talk about some best practices and why. Just as a warning at the top, we're going to look at pictures of a couple skin infections because we want to understand the gravity of the importance of having good hygiene. So those pictures are in here. I'll warn you when they're coming. First of all, on kind of a light note, this is something I literally just read before creating this video and I thought was funny. It's a life pro tip. If you can smell yourself a little, others can smell you a lot. But seriously, let's look at some of these items because we do get very close. So if possible, shower before class. Remember to have fresh breath. We will be very close to each other. And keep your nails and toenails clipped short. I clip all the white off. I cut them short until I can't see the white. Okay, your gi should be clean and completely dry. If it's still wet, it's not ready yet to come onto the mat, so make sure your gi is all the way dry. In terms of clean gi, fine smelling gi, find a detergent you like. There's a number of them out there, and if you find that you're still not getting some smell out of your gi, I've read good things about white vinegar. Just look it up online. There's a ton of resources specifically for jiu-jitsu gis. And keep in mind, this is part of hygiene. Please only come to class 100% healthy. No cough, no sniffles. Please don't come even if you've started medication and your doctor told you you're not contagious anymore. We just don't want to hear it. We're in very close quarters. There is no, I'm past the point of contagious. Just don't even come. If you sound sick, look sick, be healthy. And also part of being healthy is having healthy skin. Okay, so when you're taking a shower, you'll notice if your skin is doing something weird, but let's talk about some common issues with skin. Okay, ringworm. Ringworm is a horrible sounding skin condition because a lot of people think of a tapeworm that burrows through your skin after you drink water from a dengue river. But ringworm is just a skin infection. There's no worm. There are over 3 million cases per year. It's very common and very treatable, but it spreads easily. Okay, it spreads by skin-to-skin contact or contact with an infected surface or object. That could be a doorknob, a blanket, and it could even be our mat. I'll talk in a minute about how at Plainville Martial Arts we take care of our mat so that you're sure that we've killed everything that could possibly be on the mat. Ringworm is treated with anti-fungal medications, so something like Tinactin, something for athlete's foot, would be fine anywhere on the skin that you have ringworm. And our policy for ringworm in terms of when you can return to jiu-jitsu after you've been diagnosed with it and started treating it is it's got to be gone, visibly gone. This takes some time. It takes about 3 to 6 weeks for it to go away. So you're really going to be sidelined if you get it. So you really want to make sure that you're checking yourself in the shower, not coming in with any skin infections so that you're not sidelining your partners. Okay, let's take a look at ringworm. Okay, here's just a Google photo search of ringworm. I would say that this picture here, this picture here, this picture here, these are what it's going to start and look like. Right? You're going to have a red patch. It's itchy, and nothing in the world feels as good as scratching this patch of skin. So if you have something unusually itchy or it feels real good to scratch it on your skin, I basically never scratch an itch anymore without looking at my skin. I've had ringworm a few times just because it's common on wrestling mats. And my schools I've trained at in the past, especially early on, they didn't know how to keep the mat clean. So we saw a little bit of this back in the day. But I do know the feeling, I do know the look, and you want to be looking for this on yourself, okay? You can see how bad it can get left untreated. But, you see one of these, it feels amazing to scratch this kind of itch and you have a red spot on your skin. Doctor time. Got to go to the doctor, say, hey, I have this patch on my skin. I want to make sure it's not ringworm. And you'll be glad you did, okay? So that's a good look at ringworm. Let's look at another skin condition that comes up from wrestling mats commonly, and that is Staphylococcus, and it's another skin infection. Again, common, over 3 million cases per year. It's a bacterial infection of the skin. And the early symptoms, I've known a couple people, I've never had staph, I've known a couple people who have, and the early symptoms are red, very sore skin. And I'm talking if it was on someone's calf, there was red skin and it was very sore to where the whole lower leg was in pain. Okay, so this is very sore skin. The symptoms grow to be boils and oozing blisters. And again, spreads by skin-to-skin contact or touching an infected object or surface. Staph's the one that turns into MRSA. Okay, so when it's no longer, when your strain of staph is no longer responsive to antibiotics, that's when they call it MRSA, and you're home ridden for a while. That's something that they put you on the very heavy drugs to get rid of, and they can treat it, but it's very scary, very dangerous. Always get anything like that treated right away. So let's take a look at staph. Okay, I'm again in a Google image search here, looking at some staph infections. I would say, you know, something like this would be kind of early on. This is, you can see how this is a boil. What is a boil? It grows up out of the skin. It feels like a volcanic, enormous zit, and they do surgery to lance these and to take out the infected portion underneath the skin. There's an image on this page that reminds me something about ringworm and staph, and that is, if it's on your face, guys, or if it's on your legs, ladies, don't shave. You'll spread it. Anyhow, staph can get a lot nastier than what you're looking at right here. I intentionally looked for a spot on the page where we wouldn't see too much that was too nasty, but it gets pretty bad, especially once you see the ones that have opened up, which is why we're talking about this so seriously. Okay, listen, covering visible spots with a bandage does not reduce the spread of ringworm or staph. You're not doing anyone any favors by seeing something on your skin and covering it. Okay? If you see something on your skin, there's only one thing to do. Go to the doctor, ask what it is, find out, and treat it, and be off the mat. What I really want you guys to know is that PMA is clean. This is a very clean school. We put a lot of effort into using an antifungal, antibacterial mat cleaner every single night. Every time anyone's been on the mat, we are using an antifungal, antibacterial mat cleaner. Kills everything. If anybody bleeds on the mat, we use this same cleaner, and we follow our decontamination procedures to get rid of that blood and kill anything that might have been in it and might have gotten on the mat with this same antifungal, antibacterial mat cleaner. All surfaces at PMA are cleaned every day that we're open, and your instructors exercise good hygiene, and we care about your health and safety. It is really a priority at Plainville Martial Arts that we have a safe, clean facility, and we put a lot of extra time every night into keeping it that way. There's some other resources we provide at PMA that we want you to know about. We have showers, of course. We have 2 showers in the men's room, 3 showers in the ladies' room. We encourage you before training, after training, to use our showers. And we have all you need, obviously, to wash your hands in the bathroom. And we have hand sanitizer dispenser just off the mat. We have the shoe rack, so you can grab your footwear and put on shoes before going into the bathroom. Take them off before going onto the mat. That's just to keep bathroom floor stuff off of the mat. And we have a separate feminine products wastebasket in the ladies' room. So we really provide everything we can to help you keep the place clean, and we're keeping the place clean. And you know, if you have any questions, ask anytime. Thanks so much for having impeccable hygiene, and we'll see you on the mat.